If you're running a home health agency, you need to know about these CMS updates that went into effect this year. Missing these could result in claim denials, payment suspensions, or worse. I'm seeing agencies get caught off guard every single day. I've spent last week diving deep into latest CMS transmittals and talking with compliance officers across the country. Today, I'm breaking down 3 critical changes you need to address immediately, plus practical ways to ensure you stay compliant without overwhelming your team. Let's start with the first change that's catching everyone by surprise. The documentation requirements for initial assessments have gotten significantly more stringent. CMS is now requiring more detailed justification for skilled services right from the start of care. It's not enough to just check the boxes anymore. Your documentation needs to tell a clear clinical story that supports medical necessity. Here's what's happening. Agencies are getting claims denied not because the patient didn't need care, but because the documentation didn't adequately demonstrate why skilled services were necessary. The key phrase CMS reviewers are looking for is reasonable and necessary, and they want to see specific functional limitations tied to skilled interventions. What this means for you, your nurses need to document not just what they observed, but why it requires skilled care versus what a family member could do. For example, instead of writing patient has difficulty walking, you need patient demonstrates unsteady gait with high fall risk, requiring skilled PT evaluation for gait training and adaptive equipment assessment. Your intake team needs training on this immediately. Create a checklist of required documentation elements. Make sure every assessment includes specific functional scores, clear goals, and measurable outcomes. And here's the critical part. Review every initial assessment before submission. Yes, it takes time, but it's faster than dealing with denials. The second change involves the timely filing requirements. CMS has tightened the windows for various submissions, and they're enforcing them strictly. The 30-day window for submitting certain claims hasn't changed on paper, but the enforcement has gotten much stricter. They're now automatically rejecting claims that are even a day late, with very limited exception processes. But here's what many agencies don't realize. The clock starts ticking from the date of service, not when you complete your documentation. I'm seeing agencies lose thousands of dollars because they thought they had 30 days from when the nurse finished the paperwork. You need a tracking system immediately, whether it's a spreadsheet, your EMR's built-in alerts, or sticky notes on your monitor. I don't care what system you use, but you need something. Set alerts at day 20, day 25, and day 28. Never wait until day 30. Train your staff that documentation must be completed within 48 hours of the visit. This gives your billing team enough time to review and submit. If a nurse is consistently late with documentation, address it immediately. This isn't about being strict, it's about financial survival. The third change is around therapy reassessments and the documentation of ongoing skilled need. CMS is scrutinizing therapy services more closely, particularly when it comes to demonstrating continued improvement or maintenance needs. The old way of copying forward previous assessments with minor updates won't fly anymore. They want to see clear evidence of either progress towards goals or detailed justification for maintenance therapy. What's tripping agencies up is the transition from restorative to maintenance therapy. CMS will approve maintenance therapy, but only if you document why skilled intervention is needed to maintain functional and prevent decline. The documentation has to explicitly state why a non-skilled caregiver couldn't provide the same service. Here's your action plan. Implement a mandatory reassessment protocol every 30 days for all therapy patients. Document specific functional measurements, not subjective observations. Use standardized tests and report the scores. Show trends over time. And most importantly, if you're transitioning to maintenance, have a physician sign off on why skilled maintenance is necessary. Now, let me share something that's helping agencies stay ahead of these changes. The agencies that are thriving despite these new requirements have one thing in common. They've systemized their compliance processes. They're not relying on individual staff members to remember all of these requirements. They're building systems that make compliance automatic. Some are using simple checklist systems. Others are leveraging their EMR's built-in compliance features. And increasingly, agencies are turning to automated solutions that flag missing documentation, track timelines, and ensure nothing falls through the crack. For example, you can set up automated reminders in most EMR systems, CanTime, WellSky, Allura Plus, whichever one you have. And others have compliance modules that many agencies aren't fully utilizing. Spend time this week exploring what your current system can do. You might be surprised by the features you're already paying for but not using. If your EMR doesn't have these features, consider simple automation tools. Even basic solutions like automated email reminders or text alerts can make a huge difference. The key is to make compliance systematic and not dependent on memory. Here's what's really important to understand. CMS isn't trying to deny your claims. They're trying to ensure that Medicare dollars are spent appropriately. When you provide clear, complete documentation that tells the patient's story and justifies the care, you'll get paid. It's when we cut corners or rely on outdated practices that we run into trouble. Let me give you a specific example of how this works in practice. An agency in Ohio was facing 15% denial rate on initial claims. They implemented a simple 3-step process: clinical review within 24 hours of assessment, billing review within 48 hours, and final compliance check before submission. They also created templates for common conditions that included all required CMS elements. Their denial rate dropped to under 2% within 60 days. No fancy technology, just consistent processes and clear accountability. Every team member knew their role in the compliance chain, and nothing moved forward until each step was complete. But they didn't stop there. They started tracking patterns in their denials. They found that certain diagnoses were more likely to be denied and created specific documentation protocols for those cases. They identified which nurses needed additional training and provided targeted education. Here's your homework for this week. First, pull your denial reports for the last 90 days. Look for patterns: a certain type of claims being denied more often, or specific team members having more issues. This data will tell you where to focus your efforts. Second, create or update your compliance checklist. Include every new requirement from CMS. Make it impossible to submit a claim without completing every item. Yes, it might slow things down initially, but it's faster than resubmitting denied claims. Third, schedule training for your entire team. Don't assume everyone knows about these changes. I'm finding that many nurses and therapists haven't been informed about the new documentation requirements. A 1-hour training session could save thousands in denied claims. Fourth, audit 10 random charts from the last month. Check them against the new requirements. Will they pass a CMS review? If not, you know you have your homework to do. Fifth, implement at least one systematic improvement this week, whether it's automated reminders, a new checklist, or a review process. Start somewhere. Perfect compliance doesn't happen overnight, but every improvement reduces your risk. Remember, these CMS changes aren't suggestions, they're requirements. Agencies that adapt quickly will thrive. Those that don't will struggle with cash flow problems from denied claims. The good news is that once you have the systems in place, compliance becomes routine. Your team will develop muscle memory for proper documentation. Your billing department will catch issues before submission, and your cash flow will stabilize. Don't wait for failed audit or a pile of denials to take action. The time to implement these changes is now, while you have the bandwidth to do it properly. Your future self and your bank account will thank you. One final thought: if you're feeling overwhelmed by these changes, you're not alone. Every agency is struggling with increased compliance burden. The difference between success and failure isn't who has the most resources. It is who takes action to systematically address these requirements. Start today, pick one area to improve, build momentum, and remember, every step towards better compliance is a step towards a more stable, profitable agency. Stay informed, stay compliant, and keep providing the excellent care that your patients deserve.